Climate change and the rise of dengue fever, a growing threat to Latin America and Asia. Climate change is responsible for nearly 20% of dengue fever cases in Latin America and Asia, amounting to around 45 million infections annually. Rising temperatures and urbanization are creating ideal conditions for mosquitoes that transmit the disease, especially in regions that previously didn't experience such problems. Dengue fever is transmitted by the Aedes aegypti mosquito, which thrives in warm climates. As temperatures rise, these mosquitoes are expanding their range into areas that were once too cool for them. Additionally, extreme weather events like heavy rains and floods create standing water, providing perfect breeding grounds for mosquitoes. Rising temperatures and urbanization are key factors contributing to the spread of dengue. In large cities with poor sanitation and drainage systems, stagnant water becomes a breeding ground for mosquitoes. This is especially true in informal settlements where infrastructure is underdeveloped. Climate change is allowing mosquitoes to spread to cooler regions, such as parts of Mexico and Brazil, where dengue was previously rare. These areas may face a rise in cases by up to 150%, as higher temperatures provide a favorable environment for mosquito populations to thrive. Looking ahead, projections show that dengue cases could increase dramatically by 2050, particularly if CO2 emissions remain high. Under this scenario, dengue infections could rise by 61%, resulting in millions more cases and putting additional strain on healthcare systems. However, if significant measures are taken to reduce carbon emissions, the rise in dengue cases could be somewhat mitigated. In a scenario with active climate change mitigation, the increase could still reach 40%, highlighting the need for urgent action to address climate change and control the spread of mosquito-borne diseases. As climate change allows dengue to spread into new regions, local health systems will face significant challenges. In areas where dengue was not common, there may be a lack of immunity, which could lead to more severe outbreaks. Local healthcare infrastructure may not be equipped to handle such a sudden increase in cases. To combat this growing threat, both global and local actions are essential. Reducing greenhouse gas emissions is a key step in limiting the spread of mosquito-borne diseases. Additionally, strengthening mosquito control measures, improving sanitation, and educating the public on how to prevent mosquito breeding will be critical to limiting the impact of dengue fever in the future. Climate change is driving the spread of dengue fever, reaching regions that once had minimal cases. By 2050, if current trends continue, dengue infections could rise by as much as 61%. However, proactive measures to reduce CO2 emissions and improve local mosquito control can limit the impact. Addressing climate change and strengthening public health responses are essential to combating this growing threat.